Yeah, no, well, I don't know about that. Maybe. It's not issuing security.
Couple of hummingbirds I've had.
Nice, nice.
And they come.
Good afternoon, everybody. Thank you all for coming. And this is a presentation that I am truly looking forward to hearing and providing very, I think, critical information to the board members of the board as well as to our community members. But first I have to bring this meeting to order. It's 4:02 and I'd like to call the Committee of the Whole of June 24th, 25 to order. Clerk, could you call the roll, please?
Allen,
Allen present.
Arroyo, Bates,
Here remotely.
Berman. Mr. Berman, okay, he was online. Garcia. Doherty,
Right here.
All right.
sorry, Miss Garcia, I see you online.
Garcia here remotely.
Gripe,
Here.
Gums, Iqbal, Juby,
Remote.
Caius,
Present.
Leonard, Lewis, Linder,
Under here.
Molina,
Molina present remotely.
Ennis is here.
Roth, Sanchez, Strathman,
Strathman here remote.
Surges,
Surges remote.
Tarver,
Tarver's here.
Tepe, Williams, Young, Pirog.
Yeah.
We do not have an in-person quorum.
Okay, we will not be voting. on-
remote.
Welcome. Excellent. We will not be, when we get to approval of minutes, obviously we cannot vote on those, so we'll move those to the next Committee of the Whole. Hopefully we'll have a quorum in the room. So let's see, who has not done the Pledge of Allegiance in a long time? Miss Allen, you look so dapper today. Go ahead, please.
And Hut.
Pledge allegiance to the
To the
flag
flag,
of the
United States of America,
and to the republic
Difference. Under one.
with liberty and justice.
That's all.
We have one speaker today for public comment. Brenda Engelhardt. And Brenda, I'll read the formal matters, just so you're aware. Please, we ask that you refrain from any statements or remarks or conduct that might become disruptive to the conduct of the county board or which may cause a disturbance. And you have 3 minutes.
Thanks, Madam Chair. My name is Brenda Engelhardt. And let me open up by saying I actually ran for the King County Board. I lost to John Gripe. He ran a very, very excellent campaign, and I just wanted to say congratulations. What you all do, and I know just a tiny bit, is complex, and it's a lot of work. So thank you. My reason for being here today is personal. Let me just tell you briefly. I am the proud mother of a daughter and a daughter-in-law. And both of them, since the election in November, have had to be very, very careful about where they travel. We know that this is an administration that has been targeting LGBTQ rights, especially in health and travel. So when I told my daughter that this, some people in this organization, a majority, had actually done a proclamation, she was delighted, and I saw relief on her face. Never knew that there was any doubt at all. But that's what we're dealing with our kids and our people today. We have this example of love, tolerance, mercy. And I just wanted to thank you for setting that kind of an appeal and that kind of a vibe for our county. And for those of you that made that vote, please know there's more than hundreds or thousands. There are tens of thousands of us that are in support of you and will continue to support you. Thank you.
Thank you, Brenda. Wow, how refreshing. So today we're going to have several presentations, but before we begin, I'd like to set the stage for those presentations with just some brief remarks. I've done a little research. Before I got elected as King County Board Chairman, I was destined to be the chairman of Age Guide, which is an organization which funds senior services. I think, Marla, 7 counties. Is that correct? 8 counties. So it is the largest provider of funds for all of the senior service agencies. Obviously, I could not chair that and chair the King County Board, so I gave up the seat. but they've always been in my heart and in my mind of how we can support our seniors, because that is something that I hope we all get to be, because the alternative is not as attractive. So I did a little research on just setting the stage for what we're going to be talking about to our array of really effective speakers. Today, we're going to be highlighting the significant economic and social changes that the aging baby boomer population is bringing to Kane County. That is one of the lovely things about getting old, is that you have multiple glasses. There we go. Now I can read. As of recent data, there are approximately 70,000 residents over the age of 65, making up about 17% of the county's population. Additionally, there are roughly 80,000 residents, 50 to 64, indicating a sizable near retirement demographic that is approaching their senior years. Now, on the younger side, on the opposite side, Generation Alpha, those born from around 2010 onward, constitutes roughly 20% of Kane County's population, and they represent our future community. From a health perspective, research by AARP indicates that certain regions in the U.S., including parts of Illinois, face a higher than average prevalence of dementia among older adults. In Illinois, 12.2% of our population is at risk for dementia. According to estimates released by the 2023 Alzheimer's Association, approximately 8,500 people in Kane County are living with Alzheimer's disease. That translates to about 10.8% of the county's population who are aged 65 or older. While this is a lower percentage than the statewide average of 12%, it still represents a considerable number of individuals and families affected by this disease. The number is projected to increase significantly as the population ages, emphasizing the urgent need for expanded care services, support systems for families, and community resources on diabetes, cardiovascular health, and education tailored to address cognitive health. Economically, this demographic shift means a rising demand for healthcare, senior housing, and its related services. Local businesses and healthcare providers are experiencing increased workloads and opportunities for growth, but are truly strained due to a limited workforce going into that field because frankly, it does not pay very well. This puts pressure on public resources and infrastructure, prompting the need for expanded services and facilities tailored to an aging community. Kane County has approximately 35,000 residents, 35,000 residents who are eligible for the senior tax freeze. This number helps target financial support initiatives and identify households that may benefit most from supportive services. But on the flip coin, this also puts a burden on Kane County's other taxpayers. Socially, this demographic transition influences community dynamics. Many boomers seek engaged lifestyles, leading to the development of senior centers, recreational programs, and volunteer opportunities. Well, meanwhile, the large presence of the Generation Alpha highlights the importance of planning for educational, technological, and recreational needs to support their growth and integration in our community so we don't lose them. Their development will shape Kane County's future social fabric and economy. The aging of the baby boomer generation presents both challenges and opportunities and innovation within Kane County. By proactively addressing these changes, especially in healthcare, memory care, community planning, and recognizing the vital roles of Social Security and Medicare and emerging technologies like AI and robotics, you can believe it, our community can continue to thrive as an inclusive and vibrant residence for every age. Now with that, Our present presenters are going to be right now talking about senior population and seizing senior housing developments in Kane County, where our seniors are living throughout Kane County, transportation accessibility, our support services through our law enforcement, community programs, and key issues facing our seniors going currently and into the future. So with that, I'd like to bring on Chris Roth, who will begin our presentations to talk about the current data of our senior population.
Thank you, Madam Chair. Good afternoon, members of the board. My name is Chris Toth. I'm a planner with the Kane County Community and Development Services. I'm also a millennial, and I'm the father of 2 Generation Alpha children who live here in Kane County. I'm really excited to here just to talk to you briefly about some of the demographics of the senior population in Kane County. Next slide, please. All right. Excellent. So I have two lines running on the table right here. The census for Kane County, which shows our population a little bit over 516,000. Our population estimated for 2024 is actually to decline about 6,000. But we expect our 50+ population, as Madam Chairman spoke earlier, to increase over the next decade. Our median age in the county has upticked by about a year, and the number of households has also grown. But the share of householders 55+ has actually grown over a full percentage point. We also expect more owner-occupied homes in the county and a decrease in renters.
It's a very controversial place over the years, so.
Utilizing ESRI as a predictor for 2029, they predict that the county's population will still continue to decline a little bit, but our population of 50+ will grow, as well as the median age will also go up another year. To expect another near 6,000 households, but the share of householders 55 years older is going to grow by about 2%. The owner-occupied housing units will continue to grow, and our renter-occupied units will continue to decline. In terms of our Kane County senior population, again, Madam Chair kind of hit it on the head earlier, but our total 50+ population in 2020 made about a little over a third of the county. That's expected to grow. It went up in 2024. It went for the 65, 75, and 85+ brackets, all saw about a 1% increase during that time period. So we took a guess using ESRI to kind of predict that population. And again, it's just going to keep growing. In 2029, we expect to have over 37% of our population be over the age of 50, putting our 65-year-olds taking about nearly 20% of our population. And even still, our 75 and 85-year-old group is continuing to grow. When we were looking at senior housing, we just went through our NAICS codes for nursing care facilities, continuing care retirement communities, assisted living facilities for the elderly, and other residential care facilities. And so using the data that we had, we found there to be 22 nursing and convalescent homes, 18 residential care homes, 15 retirement communities and homes, 5 senior citizen housing projects, and then 17 other, which were multi-purpose facilities, which were some combination of the two. When we did our search for this data, we actually had 2 different reports from Lightcast and ESRI. One said about 63, but the one from Lightcast actually had 77 and was able to list those out. I give the margin of error, give or take about 3 or 4, so the number could be around that. And I also want to acknowledge that this data was provided to us by our World Business Chicago team as part of the GCEP consortium of the 7 counties. They were great and they responded to us quickly. We were allowed to get this data and put this presentation together really quickly so we can help inform you. With that, I can just go for any questions.
There we go. Go back to the slide of the data of the future generation spread. So we're looking at 50 plus when you say we're going to have population growth. So we're looking at about 30 years down the road of if everybody who's in 50 to 65 or 50 plus continues to stay here for whatever reason, it's going to be a significantly large population, a growth population.
Yes.
Okay. Did you come across any data or will we have any data of what that cost of care is in those senior residents versus owning your own home, living in place?
I did not come across that data, but that is something that we can pursue with World Business to find that out.
I think it would be important to find out what the difference in costs are. Yeah, Mo?
Madam Chair, Bates, please.
Hold on, Ms. Bates, hold on a second. Mr. Iqbal is going to be speaking.
Yeah, Madam Chair, there are two numbers. One is a 50 plus, you say is 37%.
Mhm.
But there's another slide which says 55%, 55 plus or 46%. How is that possible?
Maybe go back to the previous slide.
Previous slide, yeah.
Oh, that
Yeah,
is
right
the
here is a
percent.
That is
48%.
households.
Go one back, yeah, right here. It is, right now it is 2024, and you are saying it's 46%. But you go to the other slide,
That's at 55, not 50.
55 plus,
Yes.
but the other one is 50, and 50 plus is 37%. It should be more.
So this is the household owners versus the actual population.
Household versus population.
Yeah, this is what you're looking at for that 45% is the householders, which is the household owners versus our actual entire population for the county. So percentage of those, so percentage of the households of that 180,000. So roughly 3672, so about 36, so about 80,000 of those households.
Okay, the title should show that. So,
Okay.
So
Okay.
and I don't want to have a lot of questions because we have many other speakers. Ms. Bates?
Oh, well, I was just going to ask, the slide about the caregivers that we have in place right now, or the nursing facilities, are we in good shape or bad shape?
So, but the 77, can you flip to that slide?
Yeah, is that
There we
good,
go.
good news or bad news? That's all, thanks.
Well, I don't have an opinion on that, but in the next presentation with Roger's map of where they are, I think that can give you a better idea for that question.
That map is outstanding. Got a sneak preview of it. Mr. Surges?
Madam Chair, thank you. I just wanted to comment, like, I remember about 4 years ago, 5 years ago, Drew Froz and I had the opportunity to go down and visit one of the communities that he represented when he was on the board. And I got to this large townhome rental community, and I didn't, and I was really caught off guard. Someone made the comment to me, "We enjoy renting instead of owning." And I said, "Can you tell me what the demographic is of your renters?" Thinking it was 25 to 30-year-old people just getting out of college. And they said, "Oh gosh, no, we're all, 60 years old on up." And that caught me. I mean, I don't know why. I just wasn't prepared for that. And the bulk of them said, "Well, we all have homes in other states, warmer states for the winter months, but our grandchildren are here and we come here." Now, and so we want to live, but we don't want to own. Now, fast forward, I've been very vocal, and I think the board knows, my mother unfortunately took a tumble just 3 months ago, spent 3 months in a rehab center, and now we've convinced her that maybe it's time to give up the house with the stairs and start looking around. Holy cow, this information couldn't be more timely for me and my family, and the hundreds of other people in this situation in where I believe we are so underserved, and we're really not well defined in who we want to be as a community. I think that as a 60-year-old son, speaking for my 80-year-old parents, I expect one thing, yet when I speak with my mom candidly, yet, you know, Cliff, I'd really like to rent because I don't want to mow the lawn anymore. I don't want to shovel the snow anymore. I don't want to paint the house anymore. I don't want those responsibilities. I just want to travel a bit and know that that's taken care of. And so to our presenter, thank you for taking the time, because I think this is such an underserved and at least from my perspective, extremely naive set of perceptions that I might have. So and I know it's just a report to you and part of your job task, but to us, this is life, and thank you.
Thank you, Cliff. Okay, last one.
Yeah,
Great.
thank you, Madam Chair. Thanks, Chris. Good stuff. The 77 facilities, I mean, I'm thinking Del Webb, right? That's probably in that list.
Nope.
And it probably should be because they're what, 50 plus communities,
55.
right? They're supposed to be. Any rate, whatever they are, I'd kind of like to look at the capacity of whatever you're including, whether it's the 77 or the Del Webbs of the world and that kind of thing. Kind of interesting to see what we need. And keeping in mind that renting isn't a bad thing, like Cliff just said, you know, my parents did the same thing, but how those are classified, because my parents owned the home they were in, but paid monthly rent to the community. So it'd be interesting to see that kind of breakdown. Not right now, obviously, but at some point, because when we start making decisions, and if we're looking at broad data, we can make bad decisions.
Yes, no, this is just an overview. This whole meeting is going to be an overview. And hopefully the board will agree that we're going to be talking about next steps.
Can I ask a real quick comment? Quick question will be answered very quickly. Number one, we see the declining population. I don't know if everyone's aware, the US Census came out after the 2020 census and said that Illinois was undercounted. That we actually didn't lose population, we gained population. So I wouldn't be surprised if those numbers are going to change in 2030.
Yes.
And then also troubling to see the decline in rental units. I mean, these senior facilities, how are they classified? Some of them are rentals, some of them are owned. How do they classify senior facilities? For example, nursing, convalescent homes, residential care, the top three, then, how are they classified?
So it's interesting. We did our search. I would say of those 77, about the top four, so the nursing, the residential care, retirement codes, even all of those had 4 or 5 different NAICS codes assigned to them, because you have your hospices, you have your outpatient services. So a lot of different facilities do a lot of different things. So it's a really tricky wicket to try and classify everything and try to put it into an easy box.
So I think what we're looking at primarily are the retirement communities, the senior citizen housing, and the multi-purpose facilities. Because residential care homes and nursing and convalescent homes are for, if I could, probably high stage dementia, or for physical disabilities. And some of those are short term, others are much longer term, where you age in place and you go to different areas within that community as you are aging in place, depending upon your strength and well-being. Okay, Chris, thank you. Thank you very much. You kicked it off beautifully. All right, where are they all living? So I'm going to bring Roger Fonstock up next.
Good evening, Roger Fonstock with IT and Buildings. So a few weeks ago, I was asked by Madam Chair about how you would, look at the aging population in the county with mapping through our GIS mapping services. And we were debating a couple different ways that we could look at where the seniors are living throughout King County. So this first run of a map is based on townships. There is a map in front of the room that we put together that's colorized for townships, and I'm going to share that in a minute online. But it is based on the townships, so you'll see the sections of the townships that are identified. They're the larger squares as you see them on the map, and we'll get to that. But we're going to talk about it briefly and what that means. and then a few other points of data. So this is from USA Facts and the Census Bureau, and it kind of supports in a parallel way what Chris was saying a few minutes ago. The numbers are a little bit different because depending on which time and point in time you actually pick up the data, you get a little bit of a different number. But what they're showing you in the colorization is the population that's 50 to 64 and then the 65 and over. So if you look at the upper left corner, you'll see the 9.7% in the kind of the dark navy blue, and then you'll see the 17.4% in the purple. It's talking about the same representative populations that Chris was speaking about. I think the biggest observation of this is from 2010 to 2022. You'll see the population 65 and over in that span of time go from 9.7 to 15.7%. So it changed by 6% during that period increase. And then the other increase was in the population that was 50 to 64. It went from roughly 7.4% to 19.7. So those two, 50 and over, 65 and over, both of those increased. And then if you look at the other side of the donut circle, you'll see that on average from, about 2% decrease in other population age groups, everything from 0.5 to about 3.2. So as the population changes, we're definitely over a 10, 15-year time span, seeing the age increase for our population in Kane County. So this is the map that we put together, and the map up front is also the same map that you can refer to. And the colorization of this, the yellowish color is less than 14% in that township is over 65. And then the middle shade of blue is 14 to 20% for the township, being 65 or over. And then the greatest population of 20% and over is the dark blue. And again, you'll see Rutland Township in north central Kane. I think somebody mentioned Del Webb. That's home for it. The other one is Caneville, shows greater than 20%. I'm not sure the demographics or why that particular area is higher percentage concentration. But this is the percentage of the township that is over 65. So the other thing you have is just sheer numbers. Obviously, Elgin, Aurora, and the Fox Valley area has a lot denser population. So the percentages get a little bit diluted as your population gets larger. And I wanted to put some of those numbers up. So this is over 65 by township. And this is that part where it's telling you that while in Rutland, the percentage is 27.47, and there's 7,400 some residents over 65, you have Elgin and Aurora, and their senior populations, both 16,000 respectively. And I would add that in Aurora, when you see that, that's only the portion that's in Kane County. So it's 125,000, but that's just because that's all that's in Kane County. But this was what GIS was using in that map for the underlying data to show you what township percentage you have of 65 and over by township. One of the other things that we looked at, which we can pursue, it gets a little bit more difficult to narrow down, is we can actually do some of this heat map or locations by census tract, and we can start to narrow it down a little bit more. And we were looking at whether or not you do it by incorporated versus unincorporated township. Do you do it by, municipalities? Do you do it by census tract data? So we went with township because county is a township form of government. I thought that would be a good place to start. But we can get it more narrow if we want to get more granular about it. Going back to the map, Chris had mentioned the institutions or the organizations that provide senior services. It's hard to read on this, but I have copies and there's a map up front. If somebody wants to reference it, we'll send it out electronically. But we had 74 senior living service providers through GIS. So our numbers are really close. We're within a handful piece. But what the red dots represent on this map are where they're located. And you'll see there's just, scattered throughout the Fox River or the Fox Valley area. And as you go west, it diminishes. So as you go past Randall Road, I refer to it as the edge of the earth. At that point, you don't see very many senior living places, and you get into unincorporated and small villages. And I think our 2040 plan and the planning that we do kind of would tell you that that area out west is developing or agricultural land. So it's a lot less densely populated. Yes. Percentage wise. Yep.
A lot of farmers.
It's over 20% senior. Yep.
Mike's, please.
Oh, Mr. Doherty, I was saying that on the map. What township is that?
That's Caneville.
Caneville. If you take a look at the Caneville section, dark blue, high propensity of seniors. But we're joking, and they was calling it the middle of nowhere. It's in a rural community, rural area, but that high level. And what does that mean for going forward in 15 years? Is it going to be repopulated with younger people? That is our question.
So the next slide is about observations. And these are just some of the things that, looking at the slides, obviously the population over age 50 is increasing, just as Chris said. The population below 50 seems to be decreasing very slightly. No attributes or reasons necessarily, just the demographics and the age. You definitely see a shift in age over the past 10 years. And the greatest shift is in those over 65. We're seeing that increase. And I had the numbers for 2010, did the math. It's, in 2010, I came up with 49,900 that were over 65. And then in 2022, you jumped to 80,852. So you're roughly speaking, 31,000 population difference in a 10-year, 12-year span. All the categories below 50 were going down slightly. And all this data came from the U.S. Census Bureau. It was population from 2023 estimates. Blair, you got that? Yeah, I did, I was curious if there was interest. I mean, I heard some of the conversation about the 74 institutions or different organizations that we have on our map. We can certainly work with Chris to try to maybe get some data about the data, information about these organizations. What's their service population? How many people do they touch? What services do they provide? I think it's a large undertaking though, with 74 of them, and to get, a good understanding of them. The other thing was, if there's an interest, we could try to get more granular with like census tract data.
Ms. Allen?
That's it.
Well, here's the other thing. This is Alan. Having lived through this, I had my husband at home as much as I could, but he was in several facilities over the course of his aging. So one of the things that's going to skew your figures is you have people, I use this term roughly, people bouncing in and out, back and forth from their home to a facility, to another facility, to a stronger facility, then back home, et cetera. In fact, our dear friend, Mr. Shepard, has been in two hospitals and 2 rehab facilities and home in between, and is now in a different rehab facility, slightly different choices. And of course, his goal is to get home. So if you're trying to track this population, it's going to be moving all over the place.
Yeah. I think one of the things in the observations, and I didn't put that in there, but the population under 50 decreasing while you have birth, which would contribute to more people. So birth rates, people being born in this area, but then there's people leaving, obviously, that are under 50 as well. So it'd be interesting to understand what that the outbound is, is there a relationship? What is it? Is it college, people leaving for work? What is that under 50 population that changes by 2%? Or is it just a rounding average? It's just symptomatic of time.
Alex?
Thank you, Madam Chairman. Mr. Fosdyke, do you work with the regional board at all regarding population trends?
Who's that?
Do you work with the Regional Board of Education at all? Regarding population
I've worked
trends?
with them in the past. I didn't for this.
Okay, no, because my previous job was the school board. Now we knew 8 years ago there would be a
Yeah.
population decline
Yeah.
from the regional board because immigration's down, birth rates are way down. If I recall, when I first met Madam Chairwoman,
Yeah.
you guys were closing a school in St. Charles because people are not having children and people are aging in
Yeah.
place. I know there was a big undercount in Aurora, specifically 17,000 people. That,
Yeah.
the regional board may have more information to help you with your aging
Sure.
trends. You may want
I
to
think too,
reach out to them, get information.
speaking from personal experience, from the generation that has a bunch of kids going through college and leaving, a lot
Thank
of the kids enter college and they go other places to go to school and other places to work. And I see that in not only my own family, but in my peers and others where their kids move off in their 20s. So.
Yes, okay, Mr. Linder.
I'd be interested in seeing some more digging down at least in the Fox Valley area to see whether we have neighborhoods that are more densely senior. I don't think it's necessary out in the western part where things are pretty scattered anyway. But not an urgent thing, but sometime if somebody has time, I'd be interested in seeing it cut down, maybe the
Sure.
census tracts or something like that.
Sure.
Mr. Roth?
This map, this is pretty good. Could we get an Excel file of all of them and then have it sorted by maybe township and then maybe even by city? Because I know they're missing some in St. Charles. Also, you list what type it is.
The data points you're talking about?
Yeah, you don't need to remap it. I mean, we can go back to the original map.
Yeah.
Like, I know there's missing ones in St. Charles on the east side. Also, a definition of what all the different types are. Because there's 7 of them that are rehab services, which are only temporary homes.
Medical,
Mhm.
that's medical.
Right, right. And Mr. Shepro was in one. The one he's in now isn't listed, but it's only 8 people.
Yeah, we
And
can definitely
then we could
follow
use
up
the
on-
county board members to say,
Yeah.
hey, what about this one? What about that one?
And I
Yeah.
think again, the focus of this for the rehab centers is that they don't just restrict it to people who are seniors, and that's a small part of that population. What I really would like this board to consider are what are going to be the needs of this population as we go further to continue to have them engaged. I just wanted to share what it looks like holistically. But what are going to be the needs? How are we going to impact transportation needs, which are going to be critical? We have a shrinking youth workforce, seniors who are college educated, and we have a high level of high education throughout Kane County, have a tendency to continue to work. Research has been done on that. People who labor will retire earlier and stay retired, but those people who have training, skill sets, education, they use their mind rather than the tasks, the wonderful things that people can do with their hands. They would want to continue working. So how do we change our workforce to be able to allow these individuals to work, maybe not a 40, 50-hour work week job, some will do that, but maybe a 30-hour week work so that they can work part-time, but work professionally. And can we adjust to that? And then what other kinds of entertainment, soft skills that we need to provide as well, so that we can provide for this 30-year shift. And in the meanwhile, how do we attract and keep the younger population? Because as they age out, who's going to pay for the services that we're providing? Because we have to keep people on the tax rolls. Yes, yes, sir. Mr. Linder.
I think a lot of seniors desire to age at home, age in place. And I think the 2 big factors there are going to be transportation and affordable home health care.
Yes.
I think those are things that we really need to be looking at. right now with the crisis we have coming in transportation. I think I spoke with you the other day about the fact that bus service where I live is less than it was in the 1950s. And, for seniors to get to a point where they can't drive, but they can cook and they can do laundry, they can do a lot of things, to have to go someplace into a facility because there's no transportation can be a problem.
Agreed. So I'm glad you're all finding this interesting. Mr. Tepe has not had a chance to
Yep.
speak yet. Mr. Tepe?
Thank you, Madam Chair. Tepe here. These particular facilities are all facilities that are providing some level of assisted care. Okay. But as has been mentioned, there's a tremendous aging at home process because early on, everybody realized that we don't have the facilities to really support people. So keeping them at home as long as they can is very necessary. So there are a lot of services that are available that will provide at-home services for a fee. You have organizations like the Kane Senior Council, which delivers meals to homes, okay? And some of the local food banks and food organizations will supplement that, like Food for Greater Elgin up in the Elgin area. But aging at home is a key thing that we need to support. And as was mentioned, part of the problem is getting them transportation, also making sure that they've got some degree of interaction with other people, which is very, very necessary, and that they've got some access to medical care. Now, we've got Ride and Cane, for example, but that is very underutilized. It really is not something that people take advantage of. They'd rather get a ride from their neighbor than try to use Ride and Cane. So being able to address all of these issues, it's well beyond us.
Well, but not really. It's something that we can certainly move forward as a board, as a county, to be able to take a look at the demographics and how they are changing and what the needs are and how we can respond to them. Is similar as the school districts take a look and do the analysis and adapt and plan for future generations at schools, whether they're going to expand their schools or they're going to start closing schools, depending upon their analysis. Yes, sir.
Yeah, just real quickly, getting back to your point about the transportation, bus transportation, well, there's probably a lot of vacant office space that's along PACE routes. Ride and Cane is actually a better option for most of these people, but it's probably PACE routes where there's a lot of vacant office space that could be turned into senior housing than any other type. And I think that's something, and I've mentioned this in past meetings too, I think that's something we need to look at to see how we could convert some of this vacant office space into affordable housing, specifically senior housing, since that's the growing population.
So
I
now
heard
we're gonna
Red and Cane.
transition to Heidi Files, who's going to be talking about transportation needs.
Hi. I'll just wait for Blair to get the presentation up, but I'm here to talk to you about transportation accessibility for seniors. And I heard you mention Ride and Cane, and that's what I'm going to be focusing on. Ride and Cane is a program that increases transportation accessibility and provides curb-to-curb service, paratransit service for Kane County residents who are seniors or individuals with disabilities. The Kane County Paratransit Coordinating Council established the Ride and Cane program back in 2008. It was a combination of a bunch of individual dial-a-ride programs. And now we have countywide coverage for trips for seniors and individuals with disabilities. Program is a partnership. PACE Suburban Bus operates the service, and they provide a large subsidy. They increased their subsidy last year to be a much larger subsidy this year, and I'll get to the reason why in a little bit. But also, we have other sponsors. We have 9 municipalities and 6 townships and multiple social service organizations that assist with ridership registration. And then 16 of those are also financial sponsors. So we have sponsorships from municipalities, township, and AID, Association for Individuals with Disabilities, or Individual Development, sorry. And then we have Kane County, who provides a sponsorship. And then we seek federal funds for the remaining portion from the RTA 5310 funds to fund the service. The program uses minivans, small buses, and transportation network companies like taxi services. It operates 365 days a year, 24 hours a day. And the rider eligibility is based on the local sponsor. We do have a small portion of the program that doesn't actually use the 5310 funds, but uses ARPA funds instead to help subsidize for our veterans. And that will run until the end of 2026. It's not very well utilized. I think we had 5 trips last month for veterans, but we have about 5,000 trips a month program wide and about 10,000 riders right now that are registered with the program throughout the county. Service coverage, this is one of the challenges with the program. The coverage is different depending on where you live. So the areas that are gray never had a sponsor, a financial sponsor. You had to have a financial sponsor to have these services. So recently, in the last couple of years, Kane County picked up those service areas. So Kane County said, we want to provide medical and work trips at a bare minimum across the county. So you picked up those work trips, work and medical trips. The other areas that are colored are the various sponsors. And what's confusing for riders, especially if they move from an area in the county to a different area in the county, or for the PACE call center, is that all of these sponsors have different parameters. They may allow social trips, they may not allow social trips. Some allow grocery shopping trips, some don't. Some allow outside of the county if it's for a certain hospital in DuPage County. Some allow only within the county. Some allow 1 trip a week, round trip. Some allow unlimited. Some allow subscription services, which means I need to get to work every day by 9 o'clock and I need to be picked up at 5 o'clock. And some don't. It's a challenge of the program. It's a highly regarded program, but it is one of the challenges. So we've talked about it a little bit, but currently or historically how this has worked is we've had the sponsorships, we've had PACE, and we've had 5310 funds. Recently, PACE increased their subsidy to 50%, meaning they're going to pay for 50% of the operating costs. They gave us $2.2 million this year to pay for up to 50%. Historically, 5310 funds have paid for the other 50%. Right now, it's only paying for 25%, the federal funds, and we're utilizing the sponsorships from the municipalities, townships, and AID and the county to pick up the rest. The funding for the veterans is 50% ARPA and 50% PACE subsidy. The ride process is pretty easy. You register with one of the sponsors and then you call PACE, you schedule the ride, you wait for your pickup, you pay in cash, and you enjoy your ride. Most trips are $5 for the first 10 miles, and then it's an additional $2 per mile. So I mentioned that PACE recently increased their subsidy. Last year, I think they gave us $500,000 for the program for the entire year. This year, they gave us $2.2 million with an ask. And the ask was, please make this program equal and universal across the county so that we don't have rider confusion, we don't have call center confusion, so that there's equity for the different Kane County residents, so that they all have the same type of service available to them. This program, Lake County and McHenry County have universal programs where they have one sponsor and one set of trip parameters. Other counties are working towards that. The RTA is also encouraging us to modernize the program. As I mentioned, it's one set of trip parameters, a universal program. PACE would operate the service. PACE would register the riders instead of 18 different sponsors, and they would maintain the database instead of the county. We wouldn't have 18 intergovernmental agreements plus one with PACE plus one with the FTA. And the funding scenario that PACE is suggesting is that they'll pay for 50%, and the 5310 funds that we seek from the RTA would pay for the other 50%. The concern is if it became a one universal program and one sponsor and the county was a sponsor, what happens if one of those funding sources falls short? So there are a lot of benefits to this idea. all eligible county residents would have equal access to the services. It would be an improved rider experience. You'd have the reduced risk of inconsistent services. You'd have reduced risk of call center confusion, which happens every month. We have sponsors saying, no, I didn't authorize those type of trips. I authorized this kind of trip. We'd have streamlined administration. As I mentioned, right now we have 18 or 17, I should say, intergovernmental agreements with local agencies and local units of local government. We're billing everybody monthly to get that money to PACE. And it would strengthen the federal grant applications in the future. This is my last slide, and these are the challenges. I've already mentioned it, but PACE has verbally committed to 50% sponsorship, but there's no written guarantee. Typically, these agreements have happened on an annual basis. We all know what's going on with the transit service boards right now. They are in the middle of a budget crisis. They have verbally said to us, we do not foresee any reduction in your subsidy. They're perceiving reductions in other areas of their budget, but that's not guaranteed. Last year, I think we got the agreement in hand in about October for the January 2025 start. 5310 funds, that would be the other 50%. Those come through the RTA, their Federal Transportation Administration funds. There's never a guarantee on those either. They have historically been there, and they've historically supported the program. And I don't foresee the RTA ever saying that they didn't support the program. They are encouraging us to look to Lake County, for instance, who has 50% PACE and 50% 5310 funds. But the last challenge there is that you are facing your own budget deficit. How it works in Lake County is they assume they're getting 50% PACE, they assume 5310, but they budget for a funding shortfall. What happens if the ridership increases and the 5310 funds run out early? So this is something, we're not asking for any action, but we are discussing this with PACE. We're discussing this with the RTA. We're discussing it with some of the larger sponsors. All the smaller sponsors, the townships, the smaller towns, they're all on board. Full support, full steam ahead. Please help us out here. But larger sponsors like Aurora Township, they provide their own services. PACE has said it won't be a problem if we did transition to a universal program, because they would pay for those services through Aurora still, so that Aurora Township could still operate their transportation services. So we have some meetings, investigations, exploring to do, but that is the way these programs typically have been moving, the modernization of them. We'd also ask that in the future, we advocate for the support of more sustainable long-term funding for these types of programs. It's a very important accessibility issue for seniors, and I'm happy to take any questions.
And how would you suggest that this board does that?
Well, you could
The
support,
sustainable funding.
you could talk to your legislators. The funding has typically come from the government, the federal government, and from PACE. We'll be meeting with PACE later this month and their leadership to discuss. But probably with the reauthorization of the transportation bill, which would take in effect October 1 of 2026, that's the reauthorization process is underway. Talking to our legislators about sustainable funding for these types of program would be an important ask, I think. And then as we move forward with whatever governance is happening at the RTA and the service boards, that we are vocalize our strong support for these types of programs.
And what about local money?
Local
funding?
money, I mean, one thing that the county board could do is approve, again, last year you approved monies for a ride and cane program. Part of the monies is you need to have monies to spend while you're bringing in these 5310 funds. So you have the revenues and the expenditures. It's a larger amount than you're not using. I think last year you budgeted millions, but of the county funds, we're not using millions. We're using probably $100,000 to $200,000 of it. But budgeting millions provides that shortfall gap and allows for the expenditures and that temporary funds to exit while you're bringing in the monthly revenues from the 5310. So when you see the budget this year, and if there are line items for ride and cane, you can have discussions, ask questions, and think about, is this something that the county board wants to continue supporting? And do you want a more universal program for your seniors across the county?
Mr. Linder?
A couple things to kind of be supportive of this. A year and a half ago, I had some major back surgery and I needed a lot of physical therapy, couldn't drive.
Yeah.
So first thing I looked at was the ride and cane, and I discovered the St. Charles Geneva bus. The St. Charles Geneva bus goes to the train station in Geneva, but it doesn't go all the way to Delmar Hospital. It's kind of a inconvenient little thing. And I thought that's what there was. So I was using Uber and Lyft. It was costing me about $80 a week. And I finally, listening here, ride and cane's a different thing, signed up for that. And, 3 times a week was costing me $5 each way, $30. I was saving $50 a week. On all but one of my trips, I was the only passenger on that bus. But using Uber, you get a little Toyota and you got this man with a bad back and a walker, and you try to cram your way into the backseat of a little Toyota and hold the walker on your lap. The ride and cane, you go up and they have a little lift there, and the guy puts a safety belt up and he raises you up into the bus and you're there. You don't have to fold up the walker or anything. It's a beautiful thing. So I think we need to find some ways to publicize it, because it really is. And if you were to pick up 10 or 15% in ridership, probably wouldn't have an awful lot more costs, because they would be largely sharing those buses going along those routes. Right now you have to have 3 buses in St. Charles because one's going that way and one's going this way and one's going around in circles. You'd still have those same number of buses, the same number of drivers, but with, $5 a ride from these, you would pick up some money, and all over the county. I don't know what that would amount to, but we need to find some ways to promote the service, because it really is underutilized and it's a good service. It was more reliable than Uber or Lyft, much more comfortable, much safer, and a lot cheaper.
Thank you for sharing.
Mr. Greip?
Oh, thank you, Madam Chair. I agree with Bill that this is something we should make sure people understand, but I think it's important, and I don't know, but where can it go? How do I get there? Which part did I, that's important. But my biggest concern is the RTA. I mean, we're facing a 29 million plus deficit, and they're facing a $771 million deficit. So I don't think the House so far has the appetite to put in the kinds of taxes it's going to take to do this, because the whole state's going to have to pay for what we all benefit from. But so I think promote it while we've got it, and but be prepared if it gets cut, what we're going to do to try and help people. And you can't help people if there isn't the money, but we need to be prepared for what's coming.
All righty.
Madam Chair, one last comment. I'm not going to speak for other sponsors, but I could tell you I spoke specifically with the Village of South Elgin. Their administrators want to see this unified county system for the reasons you perfectly explained, with the rules and regulations on where the rides go. And they would be willing to continue their sponsorship. I think we got the sponsors in place. Let's utilize that money, because like I said, I can only speak for South Elgin. South Elgin says they will continue to fund this. Can't speak for Elgin Township. I can't speak for the other municipalities, but they would be willing to continue to do this as long as they change this to the Lake and McHenry model. And then RTA, we don't know what's going to happen, obviously, but this was a priority for them. It's going to make it easier for them too. And so if it's a priority now, hopefully it's going to remain a priority, because it makes it easier for them too. But money is an issue.
And it looks like South Elgin has 3 senior living communities, probably as well dispersed other aging population within South Elgin. So is that your last slide, Heidi? Thank you very much. Well done. All right. The next speakers, and here's Amy. And one of our social workers. is here as well. Little known, perhaps you don't know that the sheriff's department is very active in support of our seniors. And it may, Amy and I had a lengthy conversation and thinking about plans, how we can assist people who are asked to leave their homes for a variety of different reasons, and what happens to them if they end up being in their car. And so now you've got a 65 or 70-year-old woman who may have dementia, who packs everything into her car and parks it in a parking lot and all of a sudden takes residence there. So how do we adapt that to be respectful for them and to provide the resources for them, and also with cases of wandering? So that's what they're going to be talking about.
Yes, we did lose one, actually two. So Detective Krupp is actually working a case right now. So she sends obviously her condolences of not being here, and we just lost our other social worker. She has a meeting at 5 p.m. So again, I brought the best of the best with me to Miss Desi. So she will be talking about kind of the aging presentation, but I wanted to actually get this in front of everybody and have an open conversation of what Madam Chair had said too. We have this discussion each and every time because with the sheriff's office, we go through complex cases of somebody living in their car at 65 years age or plus maybe 85 years. Who might not want help, or it takes maybe 3 months to get help. So we just kind of wanted to go through and offer some informational pieces as to not only once the sheriff's office has that call for service, what happens? It might be 3 months down the line and our social workers are still working from day one, 3 months or a year. So we kind of just wanted to go and open eyes to see for our aging population, as Mr. Fonstock had provided with those statistics, whether it ebbs and flows, whether we have a decrease in population, increase in population, our calls for service are still there with the aging population. So without further ado, I'm going to turn it over to Miss Desi.
Thank you, Amy. I appreciate the introduction. We will touch a little bit about the Silver Alert process, like you had mentioned a little bit ago, when somebody that is 65 and older may be experiencing some confusion related to dementia and Alzheimer in their car, wandering in the neighborhood, not sure where they're going. There's a process that law enforcement does undergo, and then there is a referral process where our social workers are then provided resources and follow-up for the family. But first, just giving a little bit of background about the Special Victims Team. So myself and Brenna, who just had to leave, we're the only 2 social workers on our team, but we are working alongside our detectives and our sergeant that focuses on the population for the senior population. We could be working with seniors who may be experiencing abuse, neglect, exploitation, or any form of other kind of victimization. We are working with family members. We are triaging, completing needs assessments, and trying to do linkage to longer term support services. Some of those stats that you'll see on there is we did not have access to do like a full comprehensive research and the whole statistics for calls for service for King County at this moment. But what we did do was gather some numbers about our program. Our program started late 2020. And so some of the numbers in 2021 comprise of those numbers, but you'll see our senior well-being cases started at 17 and they've been steadily increasing. In 2022, it's up to 49, 2023, 50, 2024, 61. We're at 36. When this was compiled last week, I envision probably a couple more added to that. We're only halfway through the year, so I can predict probably we'll be in the 70, 80 range for this year. And these are cases that we are getting either referred by our deputies, being called out on scene in relation to seniors. It can, like I had mentioned a little bit ago, be an umbrella of providing support for senior well-being, making sure they're safe in their home, cases of dementia and Alzheimer's, making sure if they need to be linked to a senior home facility, what that looks like. We have had a lot of discussions about the price of homes for cost of living for some seniors, and sometimes that's a burden that we try to work with our seniors on. But going back to how we can assist in reference to that incident that you had brought up a little bit ago, when there is a senior that is in those neighborhood, maybe wandering around, and our deputies are being called for service, there's obviously a report that has to be made. So this report is going to gather a lot of information and does have to meet some certain criteria for a silver alert to be announced. This person must be 65 years or older, have a severe cognitive impairment such as dementia or Alzheimer's, believed to be at risk of serious harm or death, and then the report is filed. And then the alert would then be activated for statewide law enforcement. Now, this is obviously for if a family member's calling for their loved one. They left the home. They have no idea where they're at. They're calling in their loved one as a missing person. In reference to somebody that isn't coming in contact with the senior, that could look a little bit different because this person may not be able to give us a lot of information about who they are, their name. So that does require a thorough investigation. With our county, what is pretty helpful is sometimes our program has already been involved with certain individuals and families in the community. So if we see a call for service for a certain individual and this has happened, we can recognize that individual, contact the deputy and let them know, like, we've been working with this family. We understand the individuals that we can contact, and we provide some kind of linkage and next steps for the deputy. Other information that is relevant for the silver alert, when our deputies being called for service, they need to receive a description of the individual, full description, full name, age, height, weight, eye color, and whatnot. Clothing description of the last, what the person was last known to have been wearing, vehicle information, if anything, where and when the individual was last seen, any known diagnosis, medication needs. This is also, again, where we can come into play because sometimes we have that information if we've already been working with that population or that individual. Like our Undersheriff Johnson had mentioned, we are sometimes involved with a lot of different cases, and with being able to provide that linkage and that information, it reduces waste of time sometimes to be able to act fast and readily come to a resolution. Another component of our program is, as mentioned, we're part of the special victims team. So after the silver alert has gone through, our agency is obviously acting to locate this individual. Maybe it's other law enforcement that is locating this individual wherever this person is. That follow-up component is really important. And that's where a lot of our numbers come in too, is we're safety planning with the family. We're trying to determine if there's ways that we can keep this individual in their home, whether we can find medical IDs for these individuals so that they can be easily recognizable if they are out in the community. If there are barriers to longer term supports such as housing, how can we adjust those? I do think that an area that maybe King County can focus on is investing in more community education, awareness of social worker services. Not a lot of people know that social work services are available, and this is something that we provide free for the community. A component of our senior well-being cases is we are able to do home visits periodically and go out and continue assessments, and we can note if there's any deterioration in functioning, whether there needs to be a continued intervention, whether we need to collaborate with adult protective services, community-based agencies, having a network of people for emergency contacts for individuals too. So our continual home visits is important because we can mark when there's any changes. And I do think another thing that we could focus on too is maybe better resource mapping for seniors and their families. There's a lot of like data out there, but there's not something universal, as previously mentioned, for like riding cane, something as that. It can be so confusing for some individuals depending on where you live in King County, depending on which township and whatnot. So if we had something universal to seniors in King County, that'd be pretty cool. But I don't know what that would look like logistically wise, but I do think that that is something that a lot of families and seniors themselves have voiced that they're confused about what next steps for them. And then finally, we do see how firsthand how compassion, coordination, and timely support can change the outcomes for seniors in crisis. So we're committed to making King County safer, more supportive for everyone. And we thank you for your time. And if you guys have any questions in specific about our program, any questions about any of the information that I provided, feel free to let me know.
All right. That's looking at about 70 to 80 people you're anticipating that you're going to be interfacing with. Amy, do you have any idea for this program, what the cost is for your budget?
You know what? We're looking at that right now. So with budgeting, I don't have a final answer for that. So in coming to that, we are actually working on several things to try and see for programming. I can bring also to This is going back and forth. If we're looking at programming in the future also, we're anticipating grants. So that kind of hinges, not kind of, it does hinge on some of the grants. And I know we're kind of going back and forth on it. That's where I don't have a, finite number for us,
Okay.
just because we're still working on that for grants and programming.
But if you can, because I think we're going to be doing some
Correct.
following up on this, if you can provide that. One of the things in that reference that we're talking about, that woman, and I think she lived in Batavia or Geneva, who was asked to leave her apartment and ended up living in her car, is that there is a safe residence that they can go to, a temporary safe residence where they can be provided services. Because if we find somebody at 3 o'clock in the morning, they need to, and they're probably, I know I can speak from personal experience with family members, a little confused. I mean, very confused and twilighting because it's a different time of day. They may need just a place to stay for an overnight stay to get some sleep, so that when the dawn comes, they're think, because the sunlight really has an impact on people who are facing dementia and Alzheimer's. It's amazingly how impactful that is. So they're not taken to a sterile place, as we do with the people who may be overdosing. Very similar. We find a good place for them where they can just stabilize themselves, temporary quarters, doing the same thing for some of our seniors.
And just on a side note, we are trying to do more educational. So, Greenfields of Geneva, for example, in Mill Creek is one of our larger. We're actually going with our special victims unit to actually educate, which is free of charge, of, financial exploitation or, different elements of it. So we're trying to get, as what Ms. Desi had said, we're trying to get that educational piece out there. It's just limited amounts, because it's just when they request it, we're going out there. Obviously, all of our deputies, all of our law enforcement know our social worker program, but it's just, again, trying to, do those pieces when it's specific to helping out each and every time. So again, just let us know if you have any other questions. We're happy to help.
Are there any questions? No? Okay.
Thank you.
Thank you very much. Thank you, Amy. So now our next speaker is direct service providing, and that is going to be Geneva Senior Center Director Sherry McMurray.
Thank you very much. Really appreciate the invitation and to highlight some of what we do at the Senior Center in Geneva. Go back to the beginning. We've been around for almost 2 decades. Doesn't seem possible, but the township purchased, renovated, put an addition on a building that now serves primarily as the senior center. The township offices also exist in that space. It's been the start of that. Now we count about 1,600 members at our center that are registered members, many of whom utilize programming and services that exist at the center. We send out a monthly newsletter and calendar of activities to all our members, either via email or the U.S. Postal Service, or people just stop in and pick up a copy so they can put those things on their calendar. In renovating the center, we utilized many gifts of both furnishings, services that allowed the township, and we're a small township, to make a very comfortable, I think, and welcoming space that makes it a place that our members, many of whom may spend every day doing some type of activity or just dropping in, having a cup of coffee and a snack, visiting with their friends. So we're always happy to show new members, community members, our space, and more often than not, people join right away and hopefully become involved. Our membership, while it's the Geneva Township Senior Center, we serve many surrounding communities that probably many of the board members' constituents where they live, including St. Charles, Batavia, North Aurora, Aurora, Elburn, Maple Park, South Elgin, and Wayne. And I may be missing a couple, but it's a broad membership. If you live in Geneva Township, it's a free membership. Your tax dollars are supporting the center. There's a small membership fee if you live outside the township that amounts to $5 a month. And that really includes almost everything we do, including parties at the center, those snacks I talked about, and coffee. And maybe if you decide to do a day trip, there would be an additional cost. But short of that, it's a pretty good bargain. And we find that most people are happy to, we will work with people if it's a problem to pay that membership fee. Sometimes it's a 6-month membership, but we find our membership is diverse, both economically, socially, and so we work with people to make the community as diverse as it is. I wanted to touch on a couple of things that drives us to continue to provide programming, expand programming. You're all familiar with what happened during COVID, disproportionately to seniors, which is isolation and loneliness. It's a problem for anybody, but our seniors, our membership, the people I spoke to, usually at the end of a phone line or on a computer, suffered a lot. And that socialized isolation really makes things tough. And we find even now, things are better. We have more freedom. We don't have to distance ourselves like we did during COVID. But that connectedness, some people, it just hasn't come back for them. They still feel isolated and lonely, maybe don't go out as much as they did. We always are urging people to take the time to come to the center, even just for a bit, see their friends, have a conversation. I've run across a couple of studies that it always somewhat is surprising, although I do see it as we see people at the center every day. But this one's from the University of Michigan, recent study, and they found that 1 in 3 people between the ages of 50 and 80 say they still sometimes or often experience those feelings, or sometimes go a week or longer without social contact from someone from outside their home. And that's a sad statistic. We always hope that our members won't feel that way, that they know that they're a place to come. But I think that that's the case for many seniors, and seniors we haven't been able to reach yet at the center. I think in a way it's a wake-up call for everybody, older adults particularly, that we need to watch our neighbors and our friends and our family, and don't presume that everything's okay. Ask, how are you doing? When you come to the Geneva Senior Center, their friends and the staff, we want to know how you're doing. They have social groups that ask and call them outside of the senior center. How are you doing? They've had an illness. They've had a spouse pass away. They kind of close ranks. They get close, and that's what I see about senior centers in general. The former U.S. Surgeon General, Vivek Murthy, last month was on Meet the Press, and I happened to tune in, and he was talking about primarily COVID, but in general, the idea of loneliness and isolation. And he talked about the risk of depression, anxiety, heart disease, and stroke. All those things increase with loneliness and isolation. Overall, he said during his interview Mortality increases can be related to social disconnection. It's comparable to people who smoke or who are obese. So connections are important. Keeping isolation at bay if we can. And I think that's the responsibility of all of us as a community. We take it seriously at the senior center, but it has to occur every place. The other thing is friendship. And that's another thing we hope you get at the Geneva Senior Center. I think later in life, there are studies that show it's harder for people to make friends. But even if you have one good friend, people have expressed that one good friend who checks on them and who's somebody they know they can go to if they have something that they need help with, it's important and it makes a difference. So the senior center and any group like that can provide a way to make friends. It's groups that our folks will welcome a new member, pull them into an activity, ask for their phone number so that they can call them to let them know what's going on. And that's another thing that I think we need to see on a regular basis. The other thing our members do is they get together outside of our community, our building, and they go to lunch. Sometimes they go to lunch and then they come to the senior center, or they make evening plans and they get together after they've been at the senior center. We hope we're fostering those relationships because, again, I think it's true in a normal work environment, but we all need to find a way to connect outside of that little space that we have. I think space matters. I think that's something we found during COVID, finding enough space so that people feel like they can all coexist but not be on top of each other. So we always hope for that. We look for ways to reorder our activities so that people all have respectful amount of space. In the future, we hope to expand our center to do just that, to continue so that we can offer more services and more resources. We frequently refer to other organizations that can provide services that we don't directly provide. So we try to be that one-stop shop so that if somebody comes to us and says, I have a question, and we'll research it if we don't know the answer. And that's another thing that I believe many of our members can get stuck. It's hard to make phone calls to find out information. Sometimes people aren't very friendly. Sometimes they're not very helpful. They're short. So we try to be a space where you can ask your questions. We have time to answer them. I wanted to just go through just a few of our programming, just to give you an idea. Kind of set it into educational and intellectual. We have some of that as well as more activity oriented. We offer driver safety classes at times, computer instruction. We have a free lending library. We have a lot of member-driven education. So our members have an investment club where it's primarily educational. We have a writers group. Once a month, they share their writing. We have I can think of two active members at our center who are authors, published authors. So we've had presentations that they give about their books, about their work. We do a lot of day touring. We offer all kinds of games, as you can imagine, everything from mahjong and poker, pinochle and bridge. So it's a variety of things, and we're member driven. Our members make great suggestions, and when we can, we try to incorporate those into our programming. So I appreciate this opportunity. I would love to give any of you a tour. If you're ever interested in seeing the center, we'd be glad to show you around, and you can see a little up close and personal what a senior center is like, and at least what ours is like. Thank you.
Thank you very much. Thank you. Any questions? It's a beautiful space. I've been in it several times, and it's a very homey, welcoming environment. And I think that adds to its attraction. It's perfectly matched for Geneva and our area. It's the way it's just a perfect match. That's all I can say. It fits into the environment exactly. So thank you so much. The challenge, I'll bring the challenge. We're going to be working with you, Sherry, probably in the very near future. Now, to bring it all home, both on a national level as well as a local level, is Marla Franzek, who is the Age Guide Northeastern Illinois CEO, a former resident of Kane County.
Yes, for over 20 years. So I'm sorry to say I moved to DuPage just last year, but raised my family here and love this area, and still near and dear to me. So I'm going to try to answer some of your questions, because I think things that came up will be part of what I'm doing. I did give everybody a handout. I'm happy to give this to you electronically for everybody who's remote today. So just kind of put everything in perspective. I'm going to kind of go from big level to small level here in Kane. Also gave you a list of all of our funded partners that deliver a lot of those services that you talked about today. So when you were talking about planning, this is what area agencies on aging do. We are there to look at current needs and to look at those big needs. When you talked about facilities, when you talked about levels of care, so you went to skilled and you went to assisted living and supportive living and independent living, know that you can come to us as a resource. The Illinois Department of Public Health actually categorizes the number of beds in all of the facilities. We're happy to help you when you're looking at that future planning and what that looks like. In our area, there's over 750,000 older adults. The Older Americans Act defines an older adult at 60 years of age. Many of us wouldn't consider ourselves an older adult at that age, but that was in 1965 when the Older Americans Act was established. We fund local service providers to do many of the programs that you talked about. I know that Riding Kane, Kane Senior Council, Senior Service Associates, many of the programs that we were talking about today, caregiver support, those use federal and state dollars. Here in Kane County, last year, we awarded more than $3.7 million in state and federal funding to Kane County alone. And that funding is also leveraged by local dollars. So county dollars, township dollars, city dollars all go into our programs. So for every dollar of federal Older Americans Act, we leverage about $3 in the community. So that's really what grows those home and community-based services. And as everybody said here today, most people want to stay in their homes and stay in their communities. And these home and community-based services help wrap around what they are able to do. Let's see. Oop, I would think I went too far. Okay. Some of the things that you were talking about when we were looking at retirement and what people are facing, here's what we see out there. 2 out of 5 baby boomers have no retirement savings right now, which means they're going to largely stay in the workforce, right? Because they don't have any other options. Women in particular are at critical risk of poverty. 67% of the 85 plus face poverty. They also have higher healthcare costs. There are, of those women of 85 plus that have less than $20,000 in annual income, they're still facing almost $7,000 in healthcare costs. So that it's very hard for them to be able to maintain that living. Those risks inflation, outliving their savings, spousal loss. You can cut your income in half just by losing your spouse, and you're still have your home to maintain and all the other resources. And then again, medical expenses. Any healthcare crisis can really put somebody in jeopardy. Some of the things that we want to make sure that you recognize, those safety net programs that are out there. It is not up to the county alone to be taking care of older adults. Our federal government has put many programs in place. Social Security turns 90 this year. It was put in place when a great deal of, this is after the Depression, when people were in poverty. And this was the one program that lifted them out of poverty. Medicare, Medicaid, Older Americans Act, they're turning 60 this year. These are programs when 1/3 of older adults in 1965 were retiring in poverty because they didn't have health care, because they didn't have any way to pay for long-term care in a nursing home. They didn't have any opportunities for the Older Americans Act, those home and community-based services. These are good policies, and we just want to make sure that everybody recognizes that we have to maintain them. If we don't, then it does come to the state and county level, right? So making sure those safety net programs are still there and modernizing them. Back in, oh, I keep going the wrong way. Oh, it must be a slide going the other way. So making sure that we are promoting those good safety net policies and investing and making sure that they are there for future generations. One more time, I trust you, I can drive. One of the things that was addressed here, and I think it was the board member over there, it talked about Keene Senior Council. This is one of those funded programs that actually provides nutrition to our older adults, whether it's in the form of home delivered meals or in community dining. And so those are great opportunities for us to not only give people, if they're home delivered meals, a good nutritious meal, but also a safety check. It's eyes and ears on that older adult. If there's a medical crisis, usually it's that volunteer delivering a meal that will recognize that, or people that are not eating, or sometimes not answering the door. The community dining, we talked a lot about that social connection, and I'm going to probably spread that throughout what I'm telling you today. So critical to us. We are social creatures. We want to be part of communities. We want to be together, and community dining does that. What we see is that 33% of people, hospitalized older adults, they're malnourished. Why? Sometimes it's mobility issues. Sometimes they don't have income to pay for food, or they don't have access. We just talked about transportation. They don't have a way to grocery shop to get to things. So what we say, invest in our programs, make sure, because they are cost effective. 1 year of home delivered meals is the same cost as 1 day in a hospital. So very affordable way to take care of people. All right, I did it. Unpaid family caregivers. What we recognize, we have a care shortage, as Madam Chair just alluded to. We have far more people that are aging and growing older, and we don't have a caring workforce that is there, or that we can afford to pay for that care. So most of it falls on family, and it falls on friends. So what we see is that in Illinois, we have, I think it's 1.3 million in Illinois, 53 million nationwide, but 1.3 in Illinois are family caregivers. They are providing unpaid care. Average of 24 hours a week, and many of these people are still working while they are providing that care. 4 out of 10 are doing that. Annual caregiver costs out of pocket, almost $7,500. Some people have to drop out of the workforce because they have to care for their loved ones. Lifetime loss of income for people dropping out of the workforce, over $324,000 they can lose in lifetime savings and supports. And that really impacts, again, their ability to retire. That's why caregivers are more likely oftentimes to fall into poverty and need some of those safety net programs like Medicaid to help pay for their care. What do we say? We've got good strategies out there, though. The Older Americans Act is addressing family caregivers. Thanks, 4 years ago, the Illinois Department on Aging, the state actually issued state funding That mirrors our federal dollars. So we went from $6 million to $11 million now to help caregivers, to train them. We've got online trainings. We've got caregiver support groups. We give temporary respite services when people just need a break. The stressors of caregiving are very intense for people. Sometimes you just need to take care of yourself. We also offer financial assistance. And in order for us to sustain these family caregivers in the workforce, we need more employers to really look at their policies so that they can give more flexibility to people that are working caregivers to make sure they can still work and take care of their families. Social isolation. You heard a lot about what that impact is of that. It really is equated to smoking 15 cigarettes a day. It costs Medicare almost $6.7 billion in annual costs. It is linked to heart disease, cognitive decline, and oftentimes early death. What our strategies are out there, we've got programs, we've got social programs, but we are encouraging civic engagement, volunteerism. We have to really promote mental health support, again, making sure that our older adults are diagnosed properly. Oftentimes depression and other things are not diagnosed in older adults, and they're basically told you're just getting old, you're just tired, and they really don't pay attention to what is really happening for the older adults. We're strengthening our social connection campaigns. We are proud to say that we are partnering with our local county health departments. Here you can see our new campaign that we're doing with the King County Health Department. It is our opportunity to bring awareness to social connectedness. Not only are older adults suffering from this, but our younger population is also suffering from. This is really an intergenerational issue. This month, if you've looked at the social media that the King County Health Department has released, they're promoting volunteerism. And they're looking at opportunities for people to get engaged. Not only does it help us serve our older adults, but it also gives the people who are volunteering a purpose. Most of the people that deliver meals are over 80 that are delivering meals to older adults. So this is older adults taking care of older adults. People who give rides in our volunteer transportation programs are older adults, and they get just as much out of it as they do for the people that are getting those programs. So we're happy to do this. This program will be running all year. So love you to promote it. And we're so happy to be partnering with the King County Health Department. Looking at workforce issues, we just noted this when you saw those stats at the beginning of the program, that we are by 2030, the 55 plus workforce is going to be growing at 3 times the rate as younger workers. We have more people that are going to be over the age of 65 than under the age of 18 for the first time in our country. So what does that mean? That means more people are going to be not only needing to work because they need it economically, but also wanting to work. As Madam Chair said, there are people that want to stay engaged, that want to continue working. And for our communities, we need that workforce. We need that aging workforce, but we need to address that there are sometimes challenges to older workers. We have to look at ageism. There are many, many people that will not get hired because of ageist practices, and they don't think that they are able to do the jobs that they're going to do. But also older workers need some accommodations too. They might not want to work every day. They might want flexible job schedules. There's many jobs they can do at home that they can work. What did the pandemic teach us? Almost anything that can be done in an office could probably be done at home too. But we need age-friendly policies out there, and employers need to be able to support those opportunities. They don't always need benefits. They don't always need a lot of things. So they're very economical for people too. So getting to kind of think outside of the box, and what does that workforce look like in the upcoming years? Housing. We talked about housing, and we talked about, I love the conversation that people were talking about. Why are people making choices to rent instead of own? There are many challenges to homeownership as you age. Not only just affording the property taxes and utilities and repairs, but the upkeep of snow removal and lawn care and all of that general maintenance, sometimes it becomes a challenge. Also, people living in housing that's not appropriate for them as they age, two-story housing that they're not able to get up the stairs or be able to really adapt their houses and make them more accessible. So there's really housing for many levels, and I think that we need to be prepared for all of that. But for the people that do want to remain in their homes and want to live there, we really do have to look at housing assistance programs that help with home modification, that offering some utility relief. We've got federal programs that do that, but also at the state level. And looking at, again, I love the outside thinking of the box of like, if there are unused buildings in our communities, what could be changed and what could we do to increase our housing stock with things that are already existing? So we're going to have to get really creative as we look towards having a older population in our communities. All right. So I'm going very fast. I did give you a lot of this, but I know you've been listening to a great amount of this. I just want to tell you the value of these programs, why they matter. Without these programs, people will fall into poverty. More and more people will fall into poverty, and health outcomes will worsen, and all of that will come back to us. Think about when Medicare and Medicaid were created, there were only 16 million older adults age 65. Today, there's 62 million that are on that program that rely on Medicare for all of their healthcare needs. When we look at Medicaid, please understand that when we talked about the residents in nursing homes, long-term residents, 2/3 of them, Medicaid pays for their care in those long-term facilities. And the people that are staying in the short stay, Medicare is paying for that. So these programs are really absorbing a lot of the healthcare costs for our older adults. For the people that are in the community, Medicare will pay for all of those health cares. But what Medicare doesn't do, it doesn't really provide for home care. The only program that actually provides for in-home care is, again, Medicaid. And what happens is you have to spend down all of your resources to get Medicaid. So you have to spend down to $2,000 in order to get those home and community-based services. So expansion of Medicare to cover some home care for people, again, we know that a little bit of supports, a home delivered meal, a ride to the doctor, all of these things can maintain somebody in the community. They can keep them independent and give us those opportunities to keep them out of poverty. We do not want to see our people have to spend down their resources in order to get care. This is not what they save for all their life, and it shouldn't be our policies out there. So when you see our government cutting things like Medicaid, know that those actually impact older adults. And a cut to Medicaid is oftentimes a cut to Medicare, because many people are dual eligible, and that Medicaid is paying for all their out-of-pocket expenses for them as well too. So make sure that at the federal level, we keep these policies, and we should not be at this time cutting them. We should be expanding them. Our population is growing. Our older adults really deserve this. So my call, I didn't have it on there. You have it on your sheet, but here's my call to action for you. To preserve and expand Social Security, Medicare, Medicaid, the Older Americans Act, invest in community-based solutions, just like you were talking about today. Let's start thinking. Let's start being proactive in our communities. And let's look at what those social determinants of health are: nutrition, housing, employment, and most importantly, those connections. We want older adults to be a priority in our communities. The governor last year did sign an executive order for an Illinois multi-sector plan on aging. They're currently outlining that. We want everybody to be engaged in that, especially our counties, because this is where you're going to address housing. This is where you're going to address transportation. This is where you bring all sectors together to make sure that we are all looking at older adults as a priority. And just I've given you all our resources for King County. You've got the sheet there. Those are all of our funded partners. I know a lot of people are like, I don't know where to go to get help. We've created a network of services in your county that can do that for you. These are the ones that we've got on there. Senior Service Associates is really your front door to getting to any of these programs. They will help you navigate information, Medicare counseling, transportation, friendly visiting, caregiver resources, elder abuse prevention. Kane Senior Council, they're the one that does community dining, home delivered meals. We've started a partnership with Shi Lin in Elgin. They're offering Chinese buffet community dining as an alternative and a culturally appropriate one. Prairie State Legal Services, they do civil legal rights and free for people to help them, especially if they're facing housing issues, rental issues. They're very good at helping people navigate that, but also powers of attorney, guardianships, things like that. That's just a QR code for it. You've got the resource, and just love you to stay connected with Age Guide. We are the planners out there. We can get you that information. We are the forward thinkers out there. So you follow us on Facebook, subscribe to our aging report, we're doing a whole series on our podcast on addressing ageism. One of the things that we're really trying to combat, because guess what? We all face ageism. You could be young and face ageism. You can be old. It's one of those universal things out there that we just have to look at the way we talk and the way we think about people as people and not really judging by their ages. And together, I know that we're going to ensure that, really all of this is not just about longevity. It's really about how we're going to all age well here. And I just commend King County for being forward thinking and really trying to recognize, one, the gifts that an older population will bring you, the wealth that they bring into the communities, and also what they've done to build these communities, and that they deserve to stay here and age well. So thank you. Thank you for paying attention. I know it was a long meeting.
Thank you. Thank you, Marla, very much. Anybody have any questions for Marla? So this was indeed a long meeting, longer than our committee of whole usually. And I want to assure you that there's going to be next steps with this. The first next step is I'm going to convene. This was a suggestion that was actually brought to us by McHenry County, that we start taking a look and working with our township supervisors. Comment was made here at a meeting. We have not asked the townships of what they need. So I took that to heart, but I don't want to ask, like, what do you need holistically? What, give me your list. But I'd like to convene a meeting and we've got two board members. Mr. Pennis is here and Mr. Araro. I volunteered them and they graciously accepted the responsibility on this to meet with our townships and start talking to them. So the very first group, and we'll do it by region. I don't want all the 16 township supervisors together. It'll be, quite too much. But to talk about seniors and see what their needs are. And we can have specific criteria that we can develop and take our time to go through it. But this is certainly going to be something, I was asked by Mr. Gripe, why are we doing this? Why are we talking about this when we're on our own budget crisis? This is part of our strategic plan. Our strategic plan is 5 years. So I would encourage us to consider this part of our population, and on its flip side, to really consider how we're going to attract and keep our younger population here as well. Now, I mentioned very quickly about robotics. Robotics, because of the lack of healthcare providers that can interface with our seniors, there's incredible technology that is out there that is interfacing with AI and robotics. That is certainly something that we, with our Economic Development Council, can start looking at and start potentially developing that. I know that these are holistic plans, but those plans are out there and they're real. Other communities are doing those and they work very well. They work very well. So it could be something that we look at 10, 15 years down the road to see how your friendly robot can make sure that you take your medicine, that you take your food, that can help you with your laundry and can help stay in place. It's a heck of a lot cheaper than staying at a $100,000 facility where you can actually enjoy the life of your home. So we'll start from very basic and just start talking to our variety of different areas of our 16 different townships, what you need. What do you provide for your seniors and what Kane County in those areas also provides. So we've got that listing, which will be impactful to our constituents as well to know where our taxpayers are going and what services we are providing with that money that directly impacts them and their communities. So that'll be our next steps. And if you'd like to join the team, just tell me. I'm sure Ted will appreciate not having to go through all 16
Absolutely.
townships. So thank you so much. Appreciate you staying and hanging out. And thank you all. And then Marla, good to see you. Very nice to see you.
Yeah, we know that we lost you to a better board, so we're grateful that that you're leading the charge here and that you're making older adults a priority. And I just want to say, King County does a great job at supporting their older adults. We serve 8 counties, so I see all the variety of counties, all the way from Lake County to Kankakee County. But there has always been a solid investment in older adults, and you can see it in the programs and services that are really out here supporting older adults. So I just want to commend you for your investment in older adults.
Thank you, Marla. Love you too. And with that, may I have a motion to adjourn?
So I move.
Thank you. We have no quorum. Anyway, we don't have. a
No
motion.
quorum.
Have a good evening.